Okay, today we are gonna talk about applying universal standard of care to Ebola virus. First, what is Ebola? Ebola virus disease, or known as EBD, is a rare and deadly disease most commonly affecting people and non-human primates like monkeys, gorillas, and chimpanzees. It is caused by infection of a group of virus within the genus Ebola. Ebola virus, Sudan virus, tall forest virus, Bondingung virus, Western virus, Bombal virus. Of these, only for Ebola Sudan, tall forest, and Burden virus are known to cause the disease in people. Now a small video.
Ebola is one of the deadliest viruses known to man. It's named after a small river in the Democratic Republic of Congo where it first emerged in 1976. Up to 90% of infected individuals die from the virus. The African fruit bat is considered a natural carrier of the infection. Gorillas, chimps, monkeys, antelope and porcupines are also susceptible to catching and spreading the disease. There are several strains of Ebola: Zaire, Sudan, Bundibunjo, Reston and Thai forest. They're spread through contact with the blood, body fluids and tissues of an infected person. Researchers say airborne transmission may also be possible. After an incubation period of between 2 and 21 days, symptoms include severe fever, weakness, muscle pain, headaches, and a sore throat. This generally develops into vomiting, diarrhea, rash, impaired kidney and liver function, and sometimes internal and external bleeding to death. The Ebola virus multiplies quickly, overwhelming the immune system to fight the infection. No medicine or vaccine currently exists.
Well, now we'll talk about the transmissions. Scientists think that people are initially infected with Ebola virus through contact with an infected animal, such as fruit or bat or non-human primates. This is called a spoiler event. After that, the virus spreads from person to person, portally affecting a large number of people. The virus spreads through direct contact with a throat bat, seams, or mucous membrane in the eyes, nose, or mouth, with blood, objects, sticks, semen from a man who recovered from EBD, and such other types of transmissions that we have now. Infected fruits, bats, or non-human primates. Now Ebola breakouts.
The outbreak began in southeastern Guinea in March. Since then, it has spread to neighboring Sierra Leone and Liberia, with 814 confirmed cases across the three countries. The Ebola virus is transmitted through bodily fluids, via oral and nasal exposure, and through the conjunctiva. The virus infects and replicates in immune cells, which further disseminate the virus. Lymphocyte depletion and necrosis are observed in the spleen, thymus, and liver. Intensified immune response leads to dysregulated coagulation, which causes bleeding and hemorrhaging in the gastrointestinal tract. Compromised vascular and endothelial cells also cause blood vessel leakage, leading to hypotension. Dysregulated host immune response, coagulation abnormalities, and an impaired vascular system leads to shock and systemic organ failure. Doctors are at high risk of exposure to the virus. They must apply additional infection control precautions, including wearing personal protective equipment such as gowns, masks, gloves, and goggles, as well as ensuring complete equipment sterilization. Ebola patients must be isolated and attended by medical staff who have been trained in infection control measures.
Okay, diagnosis. Diagnosis Ebola virus disease (EBD) shortly after infection can be difficult. Early symptoms of EBD, such as fever, head shakes, and weakness, are not specific to Ebola virus infection and often are seen in patients with other more common diseases like a mutant type of fever. Okay, to determine Ebola virus infection as possible diagnosis, there must be a combination of symptoms suggested of EBD and possible spread to EBD within 21 days before the onset symptoms. And improved by include contact with blood, like I told later, after, before, uh, a lot of types of spread that this virus can have. So it's very difficult to diagnose it because they have so much common symptoms, but it's not impossible. We have to look well the symptoms of the patients, and now a video explaining the symptoms.
Diagnosis. Diagnosing Ebola in a person who has been infected for only a few days is difficult, because the early symptoms, such as fever, are non-specific to Ebola infection and are seen often in patients with more commonly occurring diseases, such as malaria and typhoid fever. However, if a person has the early symptoms of Ebola and has had contact with the blood or body fluids of a person sick with Ebola, contact with objects that have been contaminated with the blood or body fluids of a person sick with Ebola, or contact with infected animals, they should be isolated and public health professionals notified. Samples from the patient can then be collected and tested to confirm infection.
Now, treatments. Symptoms of Ebola virus disease are treated as they appear. When used early, basic interventions can significantly improve the chance of survival. This includes providing fluids and electrolytes and other types. Using medication to support blood pressure, reduce vomiting and diarrhea, and manage fever and pain, treating other infection if they occur. Recovery from EBD depends on good supportive care and the patient's immune response. Those who do recover develop antibodies that can last 10 years or possible longer. So the treatment basic is to try to repose fluids. Antiviral drugs. There is currently no antiviral drug licensed by the U.S. Food and Drug Administration or FDA to treat EBD in people. Drugs that are being developed to treat EBD work by stopping the virus from making copies of itself. Blood transfusions from survivor and mechanic filter or blood and patient are also being explored as possible treatments for EBD. In the conclusion, Dr. Jacob suggests supportive care of EBD patients continue to involve and glimmer a hope of improving standards of care for EBD. Patients have been seeing the content of the current outbreak in DRC. For instance, recent innovations such as the Alliance in the International Medical Action Care Cube system, a portable blood scoring individual patient room, allow patient-centered care through continuous observation and improve. With this, the changed co-author about the DVD, which depend on the setting higher standards provided people who are sick and suffering with the care that we ourselves will want to receive. So there are not standard basic. Now, retroviral drugs.
The thing that always fascinated me about Ebola, I really got into this actually reading The Hot Zone, was how this virus, appears out of nowhere, kills a bunch of people, and then just disappears back where it came from without a trace.
And we can label it with DID.
So I've been working on Ebola since about 2003. I have to say the part of my job that I love the most is coming into work and hanging out with a bunch of really smart people, getting to engage them about the science we're doing towards our common goal of learning more about Ebola and how to combat it, and sort of feeding off of their excitement. I'm not saying every day is like that, but that is my favorite part of the job. So you can think of the virus as this burglar that's learned how to break into this really fancy mansion that has lots of security, and it's evolved to exploit the genes and proteins and mechanisms in your own cells. It knows where all the security cameras are, it knows which wires to cut. But here's the thing, Each of those potential proteins in your body that are being used by the virus is an Achilles heel that we could target to prevent the virus from infecting you. So this is a really classic picture of what Ebola looks like. That's not really how we think about Ebola. We really think of it as this complex molecular machine that's really got two pieces. It's got the payload, which is really the genetic code that allows the virus to take over your cell and turn it into a virus factory. And that code is delivered into the cell by the delivery system, which is the membrane of the virus, in which are embedded molecules of this viral protein called the glycoprotein. So together with the membrane, the glycoprotein almost acts like the delivery system of a rocket that needs to deliver the payload.
If it's going to cleave here,
Right.
why doesn't it cleave here too?
I'm going to show you some of the strategies we're using to attack Ebola. But first, I'd like to show you exactly how Ebola infects a cell in your body. First, the virus has to convince your cell to engulf it. Then, the cell takes it up into a membrane-bound compartment called the lysosome. But Ebola actually needs to get out of the lysosome for two reasons. The first reason is that the lysosome is filled with enzymes that can destroy it, but also the virus has to get into the cytoplasm because that's where all the goodies are that it needs to copy itself. And the way the virus